Good evening, everybody. Thank you for joining us. My name is Mary Frances Walsh. I'm here in a bit of a dual role. So I am a League of Women Voters Sonoma County member, and I participate in the League's advocacy committee, but I'm also executive director of NAMI Sonoma County. So that is an affiliate of the National Alliance on Mental Illness. And because the topics of behavioral health that we're going to talk about this evening are of high interest to our organization and the people that we serve. I'm here to introduce tonight's speaker, Nolan Sullivan. So Nolan is for the County of Sonoma, the Director of Health Services. That's a department that has four divisions, and that includes public health, behavioral health, homelessness services, and administration. That department has over 700 different employees, and Nolan's role is really to provide strategic leadership to that entire department and to oversee the county's efforts to protect and promote health in our community. Nolan came to Sonoma County last year in April 2025. He previously was with Yolo County Department of Health and Human Services. He holds a Master's of Public Administration with a concentration in health services from the University of San Francisco, and he is a credentialed senior executive with the California State Association of Counties. Nolan joins us today to talk about Measure O. It's a quarter-cent 10-year sales tax approved by voters in 2020. He's going to talk about how it works, what those funds support here in Sonoma County, and about its future. So I'm going to turn it. Thank you, Nolan. If I've left anything out, please feel free to
Thank you
correct
so
me.
much, Mary Frances. I really appreciate the warm welcome and the introduction. I could not think of a better facilitator or co-host tonight than yourself and the National Alliance on Mental Illness. It's such a relevant group and topic to what we're talking about tonight. So again, thank you so much for having me. My name is Nolan Sullivan, newish. I can't really say new anymore, I guess, Director of Health Services here in the county. And I'm here to talk to you tonight about Measure O, which is a wonderful impactful mental health sales tax that the voters of Sonoma County passed a couple of years back. And I think, frankly, the county has not done enough to explain to the public, to educate the public, to share with the public what Measure O is actually doing and the benefits it's bringing to folks that really need it here in the county. So bear with me for just a second here. I'm going to load up my slide deck. Let's see here. There we go. All right, and we are moving along here. And this is our very first session doing what we're calling a Measure O Roadshow. And so we are trying to go out to service groups, to city councils, to school boards, to any constituent group that has a vested interest in health and behavioral health here in Sonoma County, and really explain to them what Measure O is doing, to answer questions, hard questions, to be held accountable and to be transparent and to discuss really what Measure O is doing and what we hope it will do in the future. And hopefully, if we go out for another measure, we'll inform voters on that choice that they'll make in a couple years, ideally. So again, Measure O is a sales tax initiative. I'm going to switch slides here. And we've got some great pictures. None of these are stock photos that you're seeing today. If you're seeing photos in this presentation, they are real people from Sonoma County. They are real facilities or they are real clients that in some way, shape, or form Measure O is impacting. And again, as I said earlier, Measure O is a 10-year quarter-cent sales tax that was approved in November of 2020. It is dedicated to mental health, addiction, and solving homelessness, mostly on the mental health and addiction side. It generates about $30 million every single year. So these are local dollars to be used in the county and only in the county, throughout all of our incorporated cities and our unincorporated here in Sonoma. It is a local tax with local control. There is no discretionary funding in this plan. It's not like the Board of Supervisors can sort of use this to pay for parks or roads or the airport. It has to go to very specific purposes that were enacted on the ballot itself back in 2020. About one third of the funding goes towards expanding services beyond the traditional system. So to build new, exciting, innovative things, which include substance use treatment, mobile crisis response, and jail-based services. And then the other two-thirds really go towards fortifying the existing behavioral health system here in the county, which serves about 5 to 6,000 people on a regular basis. These are folks on Medi-Cal that have what we call SMI, serious mental illness. And so it's folks with bipolar, folks that are schizophrenia, really serious mental health issues. And this could be children or adults. Again, I can't stress the importance of having this be locally controlled. We enter this discussion today on the heels of a state budget that is not looking too great for mental health or Medi-Cal access or health access for low-income residents across the state of California. We also have a federal government that has a fairly dramatic shift in priorities and sort of how they believe tax dollars should be spent on the social safety net. So we're seeing a lot of cuts and shifts and reductions in that space. Again, Measure O is a local tax that we have local control over, which is something to celebrate nowadays. And again, Measure O is not just for the county, it's for the cities as well. It serves whether you're an incorporated resident or you live in one of our cities in the incorporated, Measure O is helping folks in all of those respects. In fact, the most of the benefit for Measure O actually goes to folks in the incorporated cities. So Santa Rosa taking up about 50% of the user base for Measure O services. The county is not sort of hoarding this money and spending it just in the unincorporated. It benefits every citizen that needs those services across Sonoma County. Again, why did Measure O come about? Way back in 2017, if folks were here in the county, there was a pretty serious financial crisis on the behavioral health side of the house. The county, in fact, had to, after several years of significant budget deficits, had to do about 100 layoffs, and they cut dozens of contracts in the mental health space. That was pretty devastating to the mental health, behavioral health system of care. The team really just has a structural deficit, meaning that the needs to provide for mental health for Medi-Cal recipients across the county have significantly outgrown the revenues that were available. And at the time, a group of concerned citizens and concerned constituents came up with the concept of Measure O, and they got that thing on the ballot in 2020. And luckily, the voters passed that measure to help reinforce and bring about $30 million in extra services to the county. To put things in perspective, the annual budget for the county behavioral health system is about $300 million. So Measure O brings in about 10% to really kind of help out in that behavioral health space. We had a rough couple years, as many of you know. We went through COVID, we had wildfires, floods, housing loss, and significant new mandates from our state and federal partners. Cities, in a lot of cases, law enforcement is sort of asked to be the Swiss Army knife. If you've got a mental health or substance use crisis call, law enforcement, was required to go respond to these calls. In many cases, not having the tools or the training to really be equipped to deal with those crises, right? Not having a place to keep people. The jail is not an appropriate behavioral health treatment facility. Emergency rooms, surprisingly, really aren't the best place for someone to go during a psychiatric crisis either. You really want to have a place like the crisis stabilization unit, or you really want to have a place like a registered residential treatment facility for folks in lieu of the jail. And instead of sending police to a behavioral health call, wouldn't it be wonderful if we could send a crisis clinician, someone that's trained in de-escalation, someone that's trained in helping with those needs to avoid any sort of unfortunate happenstance? And so again, really trying to sort of give the right tools, the right people, and the right facilities for our existing emergency services system. And that was a big thing that we prided this measure on with the cities. And lastly, as I mentioned earlier, in 2017, the train sort of went off the tracks in terms of behavioral health funding. Measure O really helps stabilize those revenue sources that oftentimes fluctuate because of state and federal funding changes. And so Measure O helps provide some stability, some semblance of cushion for our behavioral health system. This is voter approved. These numbers here were actually approved in your ballot packet way back in 2020. So for every Measure O dollar, 22% of that dollar has to go to behavioral health facilities. 44% has to go to emergency psychiatric and crisis services, and I'll tell you what those are in just a second. 18% has to go to mental health and substance use disorder outpatient services. 14% to homeless behavioral health and healthcare coordination, And that word coordination is very important. That means case management or services for folks that are homeless experiencing behavioral health. That does not mean dollars for shelter, dollars for physical infrastructure. It means dollars for services for homeless residents with behavioral health issues. And then just 2% for transitional and permanent supportive housing. So a very small percentage can go towards brick and mortar shelter, public supportive housing units, things that traditionally you think of when you're talking about homelessness. So, well, folks' memories vary on the intention of Measure O. It really was not intended to be a homeless measure. By and large, it was mostly to support behavioral health and to support people serving those with behavioral health needs, some of which times are homeless. To date, we're about 5 years in, which is great, a little over 5 years. We have raised $164 million, which is fantastic. So Measure O, I'm sorry, we've expended $164 million through 24-25. That's the total lifetime spending of the measure itself. We'll talk a little bit about fund balance and a few other things in just a second. But again, bringing those dollars in locally and getting those dollars out locally is really exciting. And Shirley Zane, many of you may recognize, was a past board supervisor. She is now the chair of our Measure O ad hoc and a tireless champion of behavioral health. And again, continues to support us in supporting Measure O and kind of pushing this investment forward. Here's some overall stats, which are pretty exciting. I think a lot of times, unless you work in the behavioral health space, unless you have a family member or a loved one or yourself that has had a significant mental health issue or illness, you really don't know what the system is, right? And that's sort of by design. So unless you've ever had a 5150 hold, unless you've ever had a loved one in a psychiatric hospital, unless you've ever had a law enforcement call where they had to engage crisis clinicians, fortunately for you, you don't know what the system does or what it has to provide sort of on the back end. And unfortunately, as Mary Frances knows, many of us have had to go through this and our families have had to go through this. But it is a small group of folks in the total community. But I do have to say that when that safety net is there and you need it, thank goodness it is there, right? And so it is one of those things that you don't know about until it's not there, or it is a different person that approaches your child on a law enforcement stop versus a crisis clinician, or it is a long jail stay instead of a stay in a psychiatric hospital for a loved one, that you know that the system is broken. And deviating from my script a little bit here, as Mary Frances mentioned earlier on, I came from another county. I spent 17 years in Yolo County. I was an elected official in Solano County. I was a school board member and a city council member in the city of Solano or Vacaville. And I also was in fairly close proximity to the different systems in Sacramento County. One of the reasons I accepted the job here in Sonoma was the fact that we had a CSU, that we had a psychiatric health facility, that we had mobile crisis response rolled out with 3 separate teams countywide. This is one of the most robust behavioral health safety nets that I have ever witnessed or experienced. And I think the resounding experience that I've gotten so far from folks is that folks want it to do more and want it to be better and have a lot of criticisms of the system. And I think those are all fair criticisms. But coming from a place that had none of these systems, I got to tell you, we're saving hundreds of lives with some of the things that we have in place. And while there's always room for improvement, as a father with 2 sons, I sleep a little better every night knowing that I actually have the resources that my children might potentially need someday, unfortunately, if they have a behavioral health crisis. So again, we have had 3,309 patients stabilized at the Crisis Stabilization Unit. You'll hear many folks call this the CSU. This is basically a mental health emergency room. Folks don't know it. Our emergency rooms are wonderful, but oftentimes, if you're 5150 or put on a hold in an emergency room, you're going to go in, you're going to get restrained, you're going to get medicated, and you're going to get released. And that is about the extent of the services we can provide in many instances. At a CSU, you are connected to a clinician, oftentimes a psychiatrist right off the bat. You are connected to mental health medications. You are released with a follow-up plan. You're connected to post-follow-up care. You may be transferred to another behavioral health facility. It is really such a better way to treat folks that are having a behavioral health crisis. And again, since Measure O has been conceived in 2020-21, we have served 3,309 individuals at the CSU. One of the wonderful assets we have here in the county is what we call a PUF, Psychiatric Health Facility. We love our acronyms in public behavioral health. This is a place where you can go for 14 days and sometimes longer for intensive 24-hour inpatient care. So this is basically a psychiatric hospital right here in the county. It's located just off 12 in the Los Guilacos campus. It's run by a wonderful provider named Crestwood. And again, this is a local facility with local beds that your family, our neighbors, our friends in the county can go to when they need care. Many places don't have PUFs, many counties don't. And so the combination of the CSU and the PUF is a game changer here in the county. Having the facilities is only half the battle, right? You've got to have the responders and the people to go out. You would be surprised to know that most counties don't have mobile crisis systems. And up until 2024, only a handful of counties actually had mobile crisis response, where instead of sending a police officer, oftentimes with a gun, and no knock on our police officer friends, they do a wonderful job, we can send a behavioral health clinician, someone that's trained in de-escalation, someone that's trained in recognizing the signs of psychosis, someone that can help de-escalate and treat the situation appropriately. They could write a 5150 hold, they could transport to the CSU, they can do all those different things that you need. And so in that time, again, with no dedicated funding from the state or feds, we have been able to get 2,572 different folks triaged through the mobile support team with Measure O. We have been able to place 1,281 residents in residential care facilities. This would be a long-term mental health recovery facility. So this could be a group home, a care home. It is not quite a psychiatric health facility, but this is where you go once you're stabilized to sort of get back to yourself, and then be reintegrated back into society. Again, in many cases, not being able to use Medi-Cal or other funding sources. Measure O has provided the funding source for that. And then 949 beds or instances of residential crisis services. And so again, this is one of the lowest levels of care, but it's getting folks with very severe mental health issues integrated back into their community, supporting them with housing, mental health services, and really trying to stabilize that person for the long haul here in Sonoma County. So a lot of big stats to be proud of, and we'll actually dive into a couple of these slides individually next. I don't know why this slide does this. For some reason, it's the text there, and I apologize. What this slide is intended to show you is that, let me see here if I could see this really quick without the gurgly gook. There we go. 55% of Measure O funds have actually gone out directly to the community and service partners. So this could be nonprofits through ANOFA. This could be our city friends. This could be a variety of other functions that are running contracts that are outside of the county. And so groups like NAMI, groups like Buckaloo, groups, all the different nonprofit groups that we have out there, 55% of the funds to date, or $90 million, have gone directly to community partners and service providers. Santa Rosa Junior College is included in there. 4% of the funds have gone directly to cities. So checks cut directly to the city of Petaluma, the city of Santa Rosa, funding things like safe parking, funding things like the SAFE program in South County. Checks cut directly to our city partners. And 41% of the funds have gone directly to the county. And so in many cases, this is supporting contracts for beds. This could be supporting staff. This could be supporting our own MST team, which is serving the mental health needs of most of the incorporated, as well as cities of Windsor, Cloverdale, Healdsburg, Sebastopol. Again, so there is sort of a misnomer that the county is sort of hoarding the money and kind of holding on to it. These funds, by and large, about 60%, 60 cents on every dollar is going out the door to a service provider or a city partner, which we're really proud of in getting those dollars out into the community. Let's see if I can fix this here and it looks a little cleaner. Cool, we're back in business here. All right, so the stats that I just showed you were from all time, right? So from Measure O inception to current. Now we're pivoting a little bit. So I'm sharing some data now on the 24-25 annual report, which is hot off the presses. If we were in person, I'd hand you all paper copies, but we'll email you some copies or make sure you get some. But at a glance, last year in 24-25, the county spent $55 million of Measure O dollars out in the community. The largest investment, and if you notice back on that first slide, emergency psychiatric and crisis services, 55% of our money last year went to emergency psychiatric and crisis services. If I go back really fast, I don't want to give everyone an eye test here, but if you look at the emergency psychiatric and crisis services category here, we're only supposed to be spending 44% of Measure O on that category. Unfortunately, crisis and emergency psychiatric care are off the charts, right? We need more and more services in this space, and we're finding that these expenditures in this particular category are growing every single year. So this big green slice of the pie, continues to get larger and larger and larger. And that is the CSU, that's the PUF, that is the psychiatric beds, that is the mobile crisis team. That is where the bulk of the Measure O expenditures are starting to go. And again, that 55% continues to grow and grow and grow. One really cool thing that I want to mention, many folks don't know it unless you work in the Medi-Cal billing space. And if you do, I'm sorry, it's a very complicated and confusing space to work in. But when you're billing Medi-Cal, you have to put $1 up to bill $1. So the county basically has to front the money, claim the dollar to Medi-Cal, and at some point in time, a year or 2 or 3 years later, we get that dollar back with our original dollar, right? That's kind of the basic premise of how this works. So because we have Measure O available, we are able to leverage 22.1 million extra dollars in 24-25. So of that 54 million, 22.1 million of that would not have been possible if we didn't have the Measure O dollar to put up in the first place to claim back from the federal government. So not only is Measure O producing local taxes and local results, it is allowing us to leverage federal funding at a much higher rate than we otherwise would have. So again, amplifying the value of that dollar and bringing more federal dollars back in the community. Again, we talked about that green category. What's in that green category? This is the crisis section, right? So this is emergency rooms, crisis hotlines, the mobile crisis teams, law enforcement in the jail. This is usually where folks come into the system from crisis. And if you've never had a family member, if you yourself have never been through this system, if you've never known a neighbor or someone else, you're really fortunate. But when you have to enter that system of care, it's a very scary place, and oftentimes it can be a bit fragmented. Luckily, with Measure O, we're able to add some cohesion there. So we have a place for people to go, the crisis stabilization unit. We have a long-term place to stabilize, which is the crisis residential units. We have the ability, if needed, to put you in a psychiatric health facility or a psychiatric hospital right here in the county. So you don't have to drive to San Francisco to see your loved one. You don't have to drive to Sacramento. You don't have to drive to Napa State Hospital. We have that facility here, and we can pay for beds with Measure O. And again, we also have a psychiatric hospital here, as well as several psychiatric hospitals throughout the region that Measure O allows us to pay for those beds when we don't have that funding through Medi-Cal. Lastly, once you stabilize the crisis and you get someone kind of back on their feet, they got to go home at some point in time, right? They've got to integrate back into the community. So Measure O is also able to fund discharge and home services, residential care facilities that help people live at the lowest level of care. In many cases, we have to look into long-term care or conserving people. And unfortunately and sadly, in some cases, it also pays for really high-end beds at the Department of State hospitals. We have a whole contingent of folks that are called Murphy conservatees. And a Murphy conservatee is someone who has allegedly or has been arrested, not convicted, but arrested for committing a very violent crime, so a murder, a rape, or a very serious assault, but they're mentally unable to stand trial. Because of their mental illness, they are unable to stand trial. The county is obligated to, in some way, shape, or form, get them back and ready to be competent to stand trial. And if they were allegedly committing very violent, serious felonies, there's not a whole lot of facilities that will take these folks, right? So we have to pay for very expensive beds or very expensive beds at the Department of State hospitals, which in a private facility, these beds can cost around $500,000 a year for a single person, right? And so if we didn't have this funding, there are some questions about what would happen to those folks. Would they stay in jail, right? Or would they not? And we can kind of go down that rabbit hole at another date. But the Murphy conservatee issue is very challenging for Sonoma. In fact, we have the highest number of Murphy conservatees per capita out of all the 58 counties, which is a very costly and scary problem to solve. The Healing Center, this is the PUF. So we talked a little bit about Los Guillicos, and so we're kind of going into all the individual items. We were able to serve 325 individuals last year in 24-25 for a total of 81,448 bed days, which is a pretty massive amount of bed days. This significantly reduced repeat hospitalizations. Oftentimes, if you don't have a CSU or a PUF, you'll see folks just cycle through the ER and cycle through the ER and cycle through the ER because they never really get to stabilize. And again, we've improved that continuity of care, helping residents remain stable after discharge here in Sonoma County, right? In many cases, maybe these facilities exist a few counties over, but here someone can go stabilize and recharge for 14 days and come back out and sort of integrate back into the community. Mobile crisis, we are very proud of the mobile crisis teams we have here in the county. We actually have 3 teams. We have the mobile support team, which is the county's team. And the mobile support team, actually, I'll talk about them last. I'll talk about the other two first. In Response is our wonderful mobile crisis team that runs 24/7 in the city limits of Santa Rosa. It is a partnership between the Santa Rosa Police Department, Buckaloo, who provides some mental health services, Catholic Charities, which provides some homeless outreach, as well as the county, which provides 8 clinicians to staff the emergency response. And again, this is just in the city of Santa Rosa city limits. It is predominantly, if not totally, Measure O funded now at this point in time. SAFE is our wonderful partner in South County, and SAFE is run as a collaboration between the cities of Cotati, Rohnert Park, Petaluma, and Sonoma State. And so they all have a coalition of local governments that chip in for this program. It is run by Petaluma People Services as a nonprofit, which provides EMTs to staff their vans. And they are currently providing services in that region of local government that I talked about. And then we have MST, or the Mobile Support Team, which is the county team that serves everywhere else. So whether you are at the beach in Bodega Bay or you're at the border in a field by Sonoma, if we didn't talk about your city or you're in the unincorporated, then MST covers the rest. And so literally their geography is massive. They go from coast to field, from top to bottom, but they cover all of the other bits and pieces for mobile crisis response. Mobile crisis response typically is a clinician-led 24/7 mobile response to a behavioral health crisis. So generally they're dispatched from 911. They can be dispatched from the local emergency rooms. Sometimes law enforcement will dispatch them. You can call 998 or 988 and get them dispatched. And again, it's just like if you called 911 for a burglary or for a house fire. If you call for a mental health or substance use emergency, chances are they're going to dispatch one of the mobile crisis teams. Combined in 24-25, the three separate teams responded to 20,286 calls. They respond in homes, they go to schools, they go to streets, they go to wherever they need to go. And one of the primary goals is to divert people from the emergency room and to when safe, not use law enforcement, right? So having the right person for the job respond is a really big thing. All of these teams are almost entirely Measure O funded. So again, without Measure O, especially now because the state budget just cut significant funding for mobile crisis, this is the reason that we will have this system over the next couple of years. The good news right now is In Response is most likely funded with Measure O for the next 3 fiscal years. We are working on a deal with the SAFE team to fund for the next couple of fiscal years. I don't have an exact number of years just yet for you. And the mobile support team at this point in time is funded in its current geography and iteration through the duration of Measure O in 2030. So even though you'll hear about some pretty significant and awful state cuts, we do have enough funding to keep these systems sort of running kind of bare bones for the next couple of years. This is our wonderful chief of police here in Santa Rosa. And again, we've got a lot of support from law enforcement in this space. In Response had 4,800 calls last year in 24-25. I'm sorry. Out of 5,800 calls, 4,800 of those calls were a diversion from law enforcement. So there were 5,800 calls where a police officer generally could have been sent, but instead it was more appropriate to send an In Response team instead. So sending the right team for the job, the right folks for the job, making sure that we're handling those crises with the appropriate staffing and clinicians. 71% of in-person crisis responses were handled without law enforcement. So again, sending folks that are not armed, that are trained in de-escalating crisis, that are stocked with Narcan, that are ready to serve in these instances is phenomenal. SAFE at that same time period had 13,000 calls for service. And so again, Measure O making a huge difference in 24-25 with our two local systems and partners. The crisis stabilization unit, so you send out your mobile crisis teams, they establish the crisis. Where do you take the person, right? Ideally, it's probably not in the emergency room. Our emergency rooms are wonderful. We have some amazing hospital partners, but at the end of the day, they are there to treat physical maladies, right? If you've got a heart attack, a broken leg, a car accident, the emergency room is where you want to go. Where do you go for a behavioral health crisis? The CSU. The CSU is staffed with behavioral health nurses, behavioral health clinicians, psychologists, doctors, psychiatrists. It is staffed with all of the different folks that you would need if you were having a bipolar attack, a schizophrenic episode, some sort of induced, paranoia. The CSU is there for you 24/7. And so again, we took 125 folks from Mobile Crisis, that's MST Safe and In Response. Total, we were able to serve 655 individuals last year at the CSU, and we are open 24/7, 365 days a year. We don't even close on holidays, just like the ER or anything else. It is always open and it's always available to support those in Sonoma County that have those needs. Really, really proud of that team and what they do. We do a lot of work in K through 12. You've probably heard a lot in the news recently about pretty significant budget cuts, unfortunately. In a lot of cases, funding is being cut at the behavioral health programming level for a variety of different folks, which can be very challenging. But we actually have crisis clinicians on quite a few campuses here. In fact, 22 campuses across Sonoma County. Last year, we were able to connect to 109 students directly in crisis. K through 12 students, mostly high school, on Sonoma County campuses. We were able to address 33 on-campus crises. So in a lot of cases, the crisis happens at home. It happens after hours on weekends, but we had 33 active crises on campus. We were able to reach 1,500 plus through outreach and 582 students in workshops. The next slide here talks about all of the different schools and districts that we're currently in. We are currently, as I said, serving 22 different school campuses, and in some cases, they're a whole district as a campus. It's a little odd sometimes, but here is a list of the different districts that we are currently serving at, and we're always actively looking to expand and grow this functionality. So while we do wish we could help our school district partners out with some of the lower level behavioral health care, at least on the crisis end, we can reassure folks that we have a team of really capable and youth-centered clinicians on our campuses, making sure our youth are protected from suicide, from mental bullying, and from a variety of other things in their schools. We support young adults as well. We have a really amazing and robust and inspiring program at the Santa Rosa Junior College. This program supports youth ages 16 to 25, and it provides on-campus clinical support at both the Roseland Satellite Campus and the main campus in Santa Rosa. And it has an enhanced focus on Latinx and African American students. And so we have culturally competent and sensitive clinicians, and we're able to support a pretty wonderful team of folks that is seeing about 200 to 300 different students in a single quarter of last year. We are reaching about 20,000 college students through outreach and prevention efforts on campuses. And again, we have two clinicians embedded on two of the main campuses, two LCSWs, for students to access when they need those services. So that's been a really big service, a really well used and appreciated service on our Santa Rosa JC. And we look to continue to expand and reinforce that partnership, keeping our college youth safe on those college campuses. Substance use treatment's another big one. Again, substance use treatment's been kind of slow growing here in Sonoma County. Mary Frances, you can probably speak to this from the NAMI perspective. You know, opening up beds and access is always a huge thing. We've been able to essentially double our enrollment over the last 4 years, which is huge. This is mostly due in part to Measure O. And as those of you know that have a child or a loved one with an opioid addiction, or an amphetamine addiction, getting access to a bed quickly literally is the difference between life and death in many cases. And so the funding has allowed us to essentially double the beds here locally. It's allowed us to create care coordination and hire staff to follow up with folks after they are discharged. We have been able to revamp and redo and relaunch our withdrawal management program at our Orinda Center and really make sure that folks are getting access to the medications that they need to prevent withdrawals and hopefully help them on their path to sobriety. And we've been able to add quite a few new treatment partners. So Santa Rosa and Sonoma County in general have had a pretty wonderful but maybe narrow inventory of different providers to provide these services. And so we're always looking to add new providers, add beds, expand that network. And so we've been able to add a couple new partners and even encourage a new service line at one of our existing partners through Measure O funding. So again, making sure we have those substance use beds available when they're needed. And 100% increase in 4 years is something to celebrate and be really thankful for. And so again, a big thank you to the voters of Sonoma County for allowing us that capability. We were able to use $750,000 as a Measure O local match, which allowed us to bring in $3.8 million in new Medi-Cal revenue for our substance use treatment of care. And as we mentioned on the last slide, it's not always just about dollars. Unfortunately, oftentimes I'm talking about dollars and revenue and expenditures, but it was able to double our treatment capacity. And that's a really big thing for us. So for a $750,000 investment, we brought in almost 4 million, and we're able to essentially double our capacity to provide substance use treatment under what's called the Drug Medi-Cal Organized Delivery System. Homeless outreach, remember we talked on that first slide, there's 14% for services and a really teeny percent, 2% for actual facilities. The 14% has provided for about 20 different employees in the county. They are what we call the heart and soul teams. They operate shelter facilities at what's called Eliza's Village, which is at the Los Guilacos campus, at a shelter facility in Santa Rosa called Mickey Zane, which is the old Hotel Azur. And they are now operating at a new facility in Santa Rosa called Arrowwood. And so this staffs the substance use counselors, outreach specialists, mental health clinicians, case managers that work in these different areas and treat the hundreds of people in that county shelter system. We were able to serve 250 individuals last year on those teams. 56 individuals, and this is not unique. This is at a given time. The census at Eliza is about 56 at any given time, allowing us to shelter 56 folks. And some of the funding was able to help us add about 402 new housing units in 2024. So Measure O was used as a match, as a leverage point, and was able to actually expand some transitional housing beds across the county. An area that we should be really proud of, and Aaliyah, who is my partner here tonight on Measure O, that's helping me work on this, I've sort of struggled with where to include this slide or not. But I think oftentimes it's so easy to focus on the negative, to focus on the big problems, to focus on the big scary issue that's staring you in the face. I think we need to take some time and celebrate a little bit about what Sonoma County has done. And I wasn't here, I'm new, I've only been here a year. But what the county has done essentially over the last 15 years or so, and Measure O has helped catalyze some of that. Think back to 2011. Where were you in 2011? What were you doing? Think about the state of homelessness in 2011. Do you remember driving by large encampments? Do you remember Joe Rodota Trail? Do you remember kind of what that time felt like? In 2011, there was a 4,539 person point in time count, and the overall county population was much smaller. So we had a pretty massive population of homeless residents, oftentimes with behavioral health issues and a whole variety of other things in the county. As of last year, the 2025 point in count was 1,952. So over 15 years, cutting that number in half, providing services, pathways, shelters, facilities, and infrastructure to really get folks out of homelessness. And again, the last couple of years, we continue to see that point in time count falling and falling and falling. News report from 2025 and 2024, that count for the county dropped by 23%. And so, we continue to make progress in this space, and Measure O is a key tool or resource in how we continue to accomplish those gains. We're getting money out to the community. One thing we heard loud and clear was that the nonprofits, the CBOs, the folks out there doing the work, the folks out there with their sleeves rolled up really need some help. And so I am very proud to announce that we did our largest notice of funding availability, or NOFA, that we have done with Measure O to date in 2025. We got $10 million out to the community. This funded things like the safe parking lot here in Santa Rosa. It funded things like Labath Landing in Rohnert Park. It funded things like L&M Village in Healdsburg. It paid for wonderful projects through COTS in Petaluma. All sorts of amazing homeless and mental health related grants and things went out there. But in total, we have spent about $17,200,000 in direct NOFAs out to our CBO partners, to our city partners and nonprofits over the last couple of years, each year kind of focusing on something slightly different. And again, growing that number of dollars that we're putting out the door every single year to help, especially when we know other funds are starting to dry up. We are very fiscally responsible, and I see one of our amazing Measure O Oversight Committee members on the call tonight. We are mandated by state law to literally monitor every penny, every expenditure that we make. And we have a really wonderful oversight and accountability committee that oversees all of our expenditures. You can see the committee members there on the right. We have Mr. Greg Griffier on here tonight that has an eagle's eye for a budget and detail, and really make sure that we're spending those dollars wisely and that they're meeting all of the different guidelines that the voters set out for Measure O. Kevin O'Donnell there has a wonderful quote, and he's been a really great partner helping us sort of support, where Measure O goes and holding us accountable. And we're getting towards sort of the tail end of the slides here, and I went a few minutes over, but I just, again, I think you were extremely fortunate and lucky to have not benefited from Measure O if that is in fact the case. If you've never had to call MST, if you've never had to take a loved one to the CSU, if you've never had to check a loved one out of the psychiatric health facility, if you've never had to go do a visitation at a psychiatric hospital, you're super fortunate and that's a really great thing. But there's thousands of residents in Sonoma County that have to do that. And because we have Measure O, whether they're a student getting crisis services at their school, they're being treated by a compassionate physician at the CSU, they're being met by a clinician with a smile versus a law enforcement officer with a gun. Measure O is helping make those things possible in our community. And it's one of those things that until you benefit from it, until you're impacted by it, until you need it, you just don't know it's there. And we just need to do a much better story of telling the gift that frankly Measure O is bringing to Sonoma County every single day. And so again, it's not just going to county staff, it's not just going to pad county budgets. It is doing really wonderful life-saving work on a daily basis. And that wraps me up. I'm trying to get high tech here. I've got a QR code for you. That will take you right to the Measure O county webpage. Aaliyah and I also want to acknowledge that webpage is not the greatest, but we are working on it. You'll have a new and improved webpage soon. But it will alert you to all of the reports, all of the NOFAs, anything else Measure O wise that you might want. But I thank you so much for your time and your audience. This is the maiden voyage of the Measure O Roadshow. Thank you so much for having us tonight, and I am ready for Q&A.
Okay, thank you, Nolan. We do have a couple of questions. This is Mary Frances speaking. Then one of them is, can you talk a little bit about the kinds of crises that a mobile crisis response team addresses?
Yeah, I think a mobile crisis response, I mean, generally is going to be things where a dispatcher, law enforcement officer, school official, emergency room official, clearly there is no indication of violence or threat, right? So it's an instance in which someone is not waving around a weapon or an object that could hurt someone. It is typically a situation where clearly someone is having a psychiatric episode. That could be hallucinations, that could be screaming at the wind, that could be a variety of different things. That could be uncontrollable crying or mood swings, or maybe a well check of sorts. That could be just really erratic behavior, right? That might be substances, it might be mental health, it might be something else. It's pretty clear when someone's having a medical emergency, whether it's a heart attack, an asthma attack, et cetera, et cetera. If you've seen someone in psychosis or you've seen someone experiencing a mental health emergency, you probably would recognize those signs as well. So typically what would happen is the 911 dispatcher would really screen for a set of different criteria. And if in fact it was deemed that it's not criminal behavior and there's probably not violence involved, we're most likely to send that crisis clinician instead. And so they would be dispatched in lieu of those different instances. I probably should have had Wendy Tappan on the call today, who is the guru in terms of this. I'm going to tell you all the technical speak, but it's sort of filtered out, right? And so it's the difference between sending an ambulance or a police officer, right? And so there's a whole series of things a 911 dispatcher or one of our mobile crisis dispatchers have to do. So typically what would happen is the 911 dispatcher would dispatch to mobile crisis dispatch, and they would go through a series of screenings and questions to determine what that behavioral health crisis is.
I was just going to add that it is not uncommon for co-response with law enforcement. So there are some times when someone experiences a mental health or substance use crisis, and there is a concern about
100%.
safety.
100%. And usually, again, the co-response is fairly common as well. The officer typically will sort of clear the scene and validate safety and then kind of clear so that's a very common modality as well. But instead of that officer being on the call for the next 2.5 hours and kind of holding up city resources for law enforcement, they check for safety, make sure things are good, and they're able to let the clinician do their work and go off to the next call.
Yeah, thank you. And then there's another question about the kinds of services in the jail for people that have serious mental illness. What does Measure O support within the jail?
That's a great question. There's not a whole lot of Measure O expenditures that are directly on forensic services, to be honest. I think the one area that jumps to mind really is the Murphy contracts. We're spending millions of dollars on Murphy contracts. And again, right now we can have a whole separate Zoom call about Murphy's and how this whole process works and conservatees. It's that much content. But there is case law from 2 years ago that essentially deem a jail facility cruel and unusual punishment for someone with behavioral health issues, unless they have a mental health facility. Oh, yes, I can stop screen sharing. Oh, thank you. Unless they have the mental health facilities and services in the jail that meet a certain level, and they almost never do. In fact, there's not a single county that has met this legal threshold so far. So one of the interesting kind of legal conundrums right now is that a public defender can petition for habeas corpus and actually get someone out of jail that has a severe mental illness that has allegedly committed a very violent crime because they are not able to stand trial because they're not competent to stand trial, but they're really not able to stay in jail because that's not a behavioral health treatment facility. And with this new ruling, it's kind of untested case law. So what we've done to sort of mitigate that whole thing is if you've got a Murphy, we try to either get the Department of State hospitals, which can be very expensive, a couple $100,000 for a bed, or we've had to establish contracts with a couple different facilities throughout the state, private facilities that are very expensive, that could be up to $500,000, for a single placement. It's a very costly way to keep our society safe. And also, if Mary Frances, you know this too, many of us have folks in our families that have severe mental health issues and they do very erratic things and sometimes violent things, and it's not them, right? Do they deserve to sort of rot away in jail, or should they be in a facility where they're being provided humane treatment and adequate treatment to kind of restore their competency? And so that's probably the best example I can provide today. There are a couple smaller forensic programs, but really the bulk of the Measure O dollars that are really going towards that population are paying for the Murphy beds, which we're not able to build Medi-Cal on. The state doesn't pay for. This is another one of those unfunded mandates from Sacramento that, is killing the county budget, but thank God we have Measure O to support it.
Wow. And then here's another question. Thank you, Nolan. About how does the county plan basically to continue Measure O if possible? And I think that's part of why you're here this evening.
Yeah, that's a great question, right? So Measure O sunsets in 2030, right? So we're a couple years away. Before you know it, that will be here. We are doing what we're calling a Measure O roadshow. And again, I hope you've all learned something today. I hope that you understand what Measure O does a little better. And maybe you'll tell a neighbor, tell a friend, tell a family member, and maybe they'll tell a neighbor, tell a friend. And hopefully we're kind of getting the word out. I think the voters in Sonoma County are extremely educated and they're very compassionate. And I think it's my job to explain the impact that Measure O is making, and hopefully they will hold us accountable, but also gift us the ability, if and when we put Measure O back on the ballot, to continue it. If we don't continue Measure O in 2030, we will have a $40 million fiscal cliff. And a world without Measure O, frankly, in Sonoma County is a very scary place. That will close the CSU, that will eliminate mobile crisis, that will close the CAPE teams. I mean, puff beds, Murphy bed, you name it. It would be devastating. There's just not other revenue sources for the things that Measure O produces. And so I just want to make sure voters are very clear on the choice. This is not one of those situations where we want an I told you so moment. And I'm not trying to sugarcoat it and say we're doing great and vote for this or vote for that. I just want folks to understand what they're getting for the money, right? And so I think folks had faith in the system to vote for it in the first place. And I hope they feel like we've been at least reasonably decent stewards of the money since, and that maybe we deserve a second shot if and when we go back out to the ballot in a couple of years.
Okay. Thank you, Nolan. I mean, I think your presentation is quite clear. So I really appreciate that. I think, there's room for a lot of questions about, the adequacy of some of the services, as important as they are
Yeah.
in meeting the overall needs of the county. But yet, I think you've made the point without that support, we would be in trouble. So thank